Here I'm going to overview of metabolic or endocrine disorders, especially the pediatrics diabetes mellitus. So, what is diabetic mellitus? So, when your blood glucose alteration, like if your blood glucose go down or go up, we call hypoglycemia or hyperglycemia. Hypoglycemia or hyperglycemia both are alteration of blood sugar level. So why blood sugar level go hyper or hypo? Due to insufficient insulin production by the pancreas or insulin resist by the cell in the body, and patient develop diabetic mellitus. So diabetes mellitus basically two types, type 1 diabetic mellitus and type 2 diabetic mellitus. So type 1 diabetic mellitus is characterized by destruction of pancreatic beta cell which produce insulin. This results in absolute insulin deficiency. So this is the blood vessel. Inside the blood vessel, glucose and insulin. And this is the cell. So blood glucose metabolized by presence of insulin and taken to the tissue. So here showing this blood vessel full of the glucose because deficiency of insulin. So the pancreas contain the two type of cell, beta cell and alpha cell. The pancreas beta cell produce the insulin. Alpha cell secrete the glucagon. So next here, so diabetes type 1, they said metabolic characterized by destruction of the pancreatic beta cell. So when the destruction of beta cell in pancreas due to any disease like autoimmune dysfunction or exposure to the toxic or virus, patients are insulin dependent diabetes mellitus develop. We call type 1. What else? Type 2 diabetes mellitus usually arises as a result of insulin resistance, in which the body failed to use insulin properly or in combination with relative insulin deficiency. So in type 2 diabetes mellitus, the progressive insulin resistance and decrease the insulin production. Usually the type 2 patient obese or obesity is an important factor, inactivity, hypertension, also high triglyceride lead to diabetes type 2 mellitus formation. So they said insulin deficiency required the use of exogenous insulin to promote appropriate glucose use and prevent the complication related to elevate the blood glucose level, such as hyperglycemia, diabetic ketoacidosis, and if you untreated hyperglycemia, it leads to diabetic ketoacidosis. If you do not take care of diabetic ketoacidosis, both can lead to death. diagnosis based on. So how we diagnose the diabetes mellitus? So this is diagnosis based on presence of classical symptom and elevated the blood glucose level. The normal blood glucose level between 70 to 110 milligram per dl or 4 to 6 millimole per liter. So it is based on healthcare provider preference. The normal level may be lower range. So I said, when we go to diagnose the diabetes, we could check the blood sugar level. We can check blood sugar random, fasting, or glucose tolerant test, anyone. Usually the fasting blood sugar patient will be not to eat at least 8 hours. Then we check the blood sugar level, right? As I told you, the normal blood sugar level 70 to 110 milligram per dl in case of pediatrics, or 4 to 6 millimole per liter. But when we diagnose the diabetic, we can see the fasting blood sugar should be more than 126 milligram per dl. So fasting means patient not to eat at least 8 hours. Or we can check GTT. GTT stands for oral glucose tolerant test. So oral glucose tolerant test must be more than 200 milligram per dl with oral glucose tolerant test indicate patient turns to diabetic. Or random. So casual blood glucose if more than 200 milligram per dl also indicate patient have a chance of diabetic mellitus. Suppose if you want to confirmation patient have a diabetic or not, we need to check hemoglobin B A1C. It is a confirmatory test. It is called glycosylated hemoglobin. So hemoglobin A1C is the best indicator for the treatment compliance. Expected range would be 4 to 5.9%, and accepted target for diabetic patient it would be 6.5 to 8%. The goal for the patient with diabetes mellitus is hemoglobin A1C would be less than 7%. It is important to know. Now, let me continue. The children may be admitted directly to the pediatric intensive care unit because of manifestation of diabetic ketoacidosis, which may be initial occurrence when they are diagnosed with diabetes mellitus. Now here showing what are the common sign and symptom of the diabetes patient, right? So first of all, let me share with you. Patient present with polyuria. Poly means a lot. Urine means increase the urination. Polydipsia. Poly means a lot. Dipsia means eating or thirstiness. Increase the thirstiness. Polyphagia. Poly means a lot. Phagia means eating. So increase the hunger. So although patient are eating, but still their body weight should be lost. body loss, weight loss. They can feel tired, fatigue, increase the frequency of infection, rapid onset, also familial tendency. Usually patient give a positive family history, right? So the major sign and symptom of the patient is it where we can say three P's, right? 1, 2, 3, three P's. P for polyuria, P for polydipsia, and P for polyphagia, right? So if you touch the skin, we can find the warm and dry skin, dehydration. Dehydration also the common. Dehydration also lead to the diabetic complication. Also, we can see that decrease the skin turgor, weak pulse, dry mucous membrane. In late stage, we found frothy breath water. And patient have a special type of respiration we called Kussmaul respiration. So Kussmaul respiration means increase the rate and depth of respiration. Patient also complain of nausea and vomiting, weakness, and lethargy. So let me read it here. So data collection or sign and symptom. We already told polyuria, polydipsia, and polyphagia, hyperglycemia. So when blood glucose usually more than 250 milligram per dl, or weight loss, unexpected fatigue, patient eating but still they are tired, fatigue, and lethargy, headache, occasional enuresis, and vaginitis in adolescent girl, because infection frequently attacked. And late stage patient develop the fruity water of breath, right? Fruity water because of ketone body formation, and also Kussmaul respiration. Dehydration, the complication of blur of vision, slow wound healing, also change the level of consciousness, right? So change the level of consciousness or decrease level of consciousness, also sign of hypoglycemia. So what else? Long-term effect. So in the long-term effect, we can see the patient has a eye problem, patient have a kidney problem, patient has a peripheral nervous system problem. If we see the eye, patient develop retinopathy. It's called diabetic retinopathy, cataract, and glaucoma. In fundoscopic examination, we can see the red spot in retina. Also, the microangiopathy develop in the brain, cerebral vascular infarction, hemorrhage, hypertension, silent MI. So patient who have diabetic for a long time uncontrolled, they develop myocardial infarction and without any sign and symptom. Or patient develop atherosclerosis, kidney problem we call diabetic nephropathy, especially patient develop glomerulosclerosis or arteriosclerosis, also pyelonephritis or nephritis. So this is the pancreas. The cell is called islets of Langerhans. So when the islets of Langerhans, the pancreas can secrete insulin, which is helps to metabolize the glucose, and also pancreas secrete amylase we call pancreatic amylase helps to digestion of the protein. So the patient who have diabetic for a long time, they chance to develop peripheral neuropathy, right? And peripheral vascular arteriosclerosis, gangrene, and infection or ulcer developed. So in this chapter, later on, when we go, we will discuss about the how to take care of the diabetic mellitus food. As a healthcare provider, I will explain it. So now, failure to grow at a long normal rate. We are going to focus here pediatrics. So it is important if the children's or pediatrics diabetes mellitus is not under control, the failure to growth, delay maturation, recurrent infection, neuropathy, vascular disease, retinopathy or retinal microvascular disease, or a renal microvascular disease developed. We call nephropathy, retinopathy, and neuropathy. In this picture, everything same. I want to a little bit recap. The picture here, you can see the nervous system, peripheral neuropathy developed, right? And also peripheral arterial disease, more common in case of uncontrolled diabetes patient. Diabetic food care is important. So in this picture, you can see the blackening, ulceration developed. If you not treat, patient need to cut the limb, we call amputation. So when you take care diabetic patient, food care is important. We inspect their feet daily, and also we, like patient need to take the shower. So test the water temperature with your hand, and also use the lukewarm water. And after wash the feet, dry the feet gently and thoroughly after bath. Always we use moisture to the feet. Also encouraging your patient to wear cotton sock or wear the leather shoes. And when we cut the nail straight across. And do not use over-the-counter product such as product for corn or cellulitis. And we do not apply any kind of heat pad or hot water bottle to the feet. Important as a healthcare worker, we need to know. And patient develop the retinopathy, means damage the blood vessel in retina, which can cause blindness. Nephropathy develop, lead to the glomerulonephritis. In the heart, silent MI, heart disease or brain stroke. So here in this picture showing the kidney, diabetic nephropathy, and showing the brain, cerebral disease or stroke. Also coronary heart disease, silent MI, means MI developed without any sign and symptom, dangerous for the patient. Here, complication if diabetic is untreated. What complication? Hypoglycemia developed or hyperglycemia developed. So if your patient develop hypoglycemia, like you give the insulin, and insulin is too much doses, or if after the insulin patient do not eat a good food, adequate food, and patient chance to develop hypoglycemia. It means blood sugar level go down. So when blood glucose go less than 60 milligram per dl, patient develop hypoglycemia. But what are the signs and symptoms of hypoglycemia? We can see patient feel hunger, irritability, headache, too much sweating or diaphoresis, pale and cold skin, tachycardia, or difficult of concentration, or very late stage patient develop seizure or coma, right? Coma, diabetic ketoacidosis or hyperglycemia is a complication. So you see electrolyte imbalance occur, which call either hypokalemia or hyperkalemia. Microvascular change, cardiovascular change means MI. For the child with diabetic mellitus, plan to initiate a consultation with diabetic specialized doctor to the plan of care. So now here, diabetic mellitus patient education, right? Patient teaching. The first teaching, what are the food they should intake. Patient education, we will talk during the sickness, right? First of all, come in the diet. The normal healthy nutrition will be encouraged, encourage them to eat healthy food. The total number of calories is individualized on the basis of the child age and growth. Because the diabetic in children, if you do not give enough adequate food, their growth will be disturbed, will be stopped. So we encourage good food and promote the growth and development. As prescribed by the healthcare provider, children with diabetic need no special food or supplement. But whatever we do, it is good to talk to the healthcare provider. And they need a sufficient calorie to balance daily expenditure for energy and to satisfy requirement for growth and development. Dietary intake should include the 3 well-balanced meal per day and eaten a regular interval plus a mid-afternoon snack and a bedtime snack, and constant intake of prescribed protein, fat, and carbohydrate at each meal. So a complete food is needed. Concentrated sweet are discouraged. Fat is reduced to 30% or less of the total calorie replacement, right? So next here, the diet. Tell the client and prepare that the child should carry a source of glucose with him or her at all the time to prevent the hypoglycemia. Because hypoglycemia is a danger sign, right? And patient go under the shock. level of concentration will be altered. To prevent the complication, make sure patient carry some glucose tablet or like candy. Incorporate the diet into individual child needs or likes, dislikes, lifestyle, culture, and socioeconomic pattern. So during the food choice, you also talk to the children, give their choice priorities, allow the child participating in making food choice to provide a sense of control. Exercise, right, is the habit. Now we focus here exercise. Because if patient develop diabetic mellitus type 2, we try to tell them food modification, do some physical exercise, lifestyle change, and control the blood sugar level, right? Exercise guideline for diabetes fitness. So frequency of exercise, intensity of exercise, and time is important, right? So if the patient FIT, fit, F stand for frequency, I for intensity, T for time. So tell your patient, do some aerobics activities, even walking, but it should be 20 to 30 minutes, right? Intensity 60 to 80% maximum heart rate, and frequency at least 3 to 4 times per week. So let me read it first. Instruct the child regarding dietary adjustment to consider when exercising. Extra food must be consumed for increased activities. Also instruct the child to check the blood glucose level before exercising. Plan an appropriate exercise regime with the child and incorporate the child developmental states. And next here, insulin, right? So what you can tell your patient about the insulin. So insulin, dilute insulin may be required for some infant to provide small enough doses to avoid hypoglycemia. Also, diluted insulin should be clearly level to avoid dose error. So laboratory evaluate of glycosylated hemoglobin, we call hemoglobin A1C, should perform every 3 months. So hemoglobin A1C basically confirmation about the diabetics. As I told you, the expected range 4 to 5.9%, right? So reference interval hemoglobin A1C less than 6%. Acceptable target for diabetic children 6.5 to 8%. So what the goal for the patient with diabetic hemoglobin A1C less than 7%. Illness, infection, and threats increase need for insulin. Insulin should not be withheld in this condition when patient ill, infection, or stress. Some books said increase the stress lead to increase the secretion of epinephrine, and epinephrine also impaired the glucose balance. When the child is nothing by mouth for a special procedure. Verify with healthcare provider the need to withhold the morning insulin and when food, fluid, or insulin are to be given, right? So here showing insulin. So reinforced instruction to the child and parents regarding administration of insulin. Reinforce instruction to the child and parents regarding how to recognize the symptom of hypoglycemia and symptom of hyperglycemia. Both is important. So now showing in this picture the insulin injection site in the both side of the umbilicus, deltoid muscle, or anterior and lateral side of the thigh, outer arms, abdomen, hip area, or thigh, right? So abdominal injection site should be the best, followed by outer arm, followed by thigh, and then buttock. So like in this picture, patient giving the insulin left side, tell them next time to right side. So rotate the subcutaneous injection site to prevent lipohypertrophy. Administer 4 to 5 injections in one site before switching to another site. Injection at 90-degree angle is best. 45-degree angle if patients are very thin, right? So during the insulin administration, we could educate our patient or parents. Tell them mixing the insulin, better draw up the clear or short-acting insulin before cloudy or long-acting insulin. So draw the clear insulin first, then cloudy. Other name of clear insulin called short-acting insulin. And never mixed long-acting insulin. Example is insulin glargine with other insulin. Important for NCLEX support. So now let me go the next here. So insulin here. So self-monitoring blood glucose and cell injection. So reinforce the instruction to the parents in the administration of glucagon intramuscular or subcutaneously, right? Glucagon, you see. So if the child has a hypoglycemia, so hypoglycemia, if we see patient develop the sign symptom of hunger, irritabilities, shakiness, headache, diaphoresis, pale, tachycardia, difficulty of concentration, or seizure or coma. In that scenario, it indicates hypoglycemia develop. We give them glucagon, right? Reinforce the instruction to the child and parents to always have a spare bottle of insulin should be available. And advise the parents to obtain a medic alert bracelet that indicate the type and daily insulin dose that has been prescribed for the child. Right? So self-monitoring blood glucose, you educate your patient, do not puncture the pad to the finger. You see, this is the finger. So do not puncture the pad of the finger. It is good use the skin to either side of the finger for better blood flow and less pain. So it is good to do not pick in the tip of the finger, better to any side for better blood coming. And always keep in mind, educate your patient, perform before meal and at the bedtime. So blood glucose monitoring. Result provide information need to maintain good glycemic control. Blood glucose monitoring too is more accurate than urine testing. So we can get the blood sugar or urine sugar level, but blood sugar is better or accurate than urine sugar, and require that the child pick himself or herself several times a day or as prescribed. Reinforce the instruction to the child and parents in the proper procedure for obtaining blood glucose level. As I told you, do not puncture the pad of the finger. Use the skin to either side of the finger pad for better blood flow and less pain. And also the the importance of hand washing before and after performing the procedure to prevent infection, and perform before dinner or lunch or at the bedtime. What next? Stress the importance of following manifestation in instruct for blood glucose monitoring device. Reinforce instruction to the child and parents to calibrate the monitor as instructed by manufacturer. Reinforce the instruction to the child and parents to check the experience, right? Also, reinforce the instruction to the child and parents that if blood glucose result do not seem reasonable, they should instruction or reassess the technique, check the expiration date of the test strip, and perform the procedure again to verify the result. So now, next here. So if listening the pain of blood glucose monitoring, how to hold the finger under the warm water for a few seconds before puncture site. So this is the strip. Needle is there, tip of the finger. So they said we have to wash it before puncture, encouraging the blood flow to the finger. Use the ring finger or thumb to obtain the blood sample because blood flow more easily to these areas. or puncture the finger just to the side of the finger bed, because there are more blood vessels in this area and fewer nerve ending. So don't go in the tip. Press the lancet. This is the needle or lancet. This is the tip of the lancet. Device highly against the skin to prevent deep puncture. Use the glucose monitor that require very small blood sample for measurement. Now, little bit talk about the urine testing, right? So, here, urine testing. So, reinforce instruction to the parents and child in procedure for testing the urine for ketone and glucose. Reinforce instruction to the child that second void urine specimen is the most accurate. And also, the presence of ketone may indicate the impending ketoacidosis. Urine glucose testing is an unreliable method of monitoring the glucose level. However, the urine should be tested for ketone when the child is ill and when the blood glucose level is greater than 200 milligram per dl or greater than 11.4 millimole or less specific or specified by the healthcare provider. So when we deal with the patient who are sick because of hyperglycemia or hypoglycemia, we monitor the blood glucose more frequently when patients are sick, means every 3 hours. And we test the urine for ketone even every 3 hours. And we do not script the insulin or anti-diabetic medication even when they are sick. And always keep in mind, we have to avoid the dehydration because dehydration causes the complication of diabetic patient. So stay hydrated. Make sure your patient drink at least 2 to 3 liters of water every day. This liquid or water must be sugar-free, non-caffeinated liquid. And always we notify the doctor for blood glucose if it is more than 200 milligram per dl, or some books said more than 240 milligram per dl, or if patient diabetic with fever, temperature is more than 38 degrees Celsius. If we say the urine is positive for ketone body, this is the strip you see in the picture. It is the urine. When you put the strip inside the urine, the particular color indicate the sugar, indicate the ketone body. So if we see the urine positive for the ketone or patient confused or rapid breathing, we have to notify to the health care provider. So both cases, if patient hypoglycemia or hyperglycemia, both cases we have to take care of, we have to management the patient very carefully.